Hiya, I'm Anna and I'd like to talk to you today about how to massage your pelvic floor scars. So just a few words of caution before we begin. So if you've just had a baby, you need to wait until any scars from episiotomies or tears are fully healed. So that might be about 3 or 4 months postnatal at least. Any time after that is totally fine. Second word of caution is if you have a coil in place, then if you're about to embark on doing some pelvic floor massage, you just need to have a bit of a check of where your coil strings are and how long they are. And if you notice a change in string length at any point, then just pop down to the nurse at your GP and get them to just straighten it out for you, okay? A bit of a bigger word of caution is if you've ever had any major pelvic surgery. So that's hysterectomies, prolapse repair surgery, or any other kind of major pelvic floor surgery, or any major pelvic surgery at all. So if that's you, please don't try this at home on your own. Instead, please go and seek a proper assessment so that an individualized treatment plan can be worked out for you. If you're pregnant, this kind of massage is not suitable throughout the majority of your pregnancy. It is okay to do this in the last couple of weeks of pregnancy if your midwife says it's safe for you to do so. But please don't do this through the majority. In the early weeks, the mid-trimester, and even in the third trimester up to about last couple of weeks. Okay, so the best position to do this massage in is sat leaning back like this. So leaning in bed is good with some cushions behind you, or just nice and comfy. It works really well to do it at the end of the day in bed. Make sure that everything's nice and relaxed. Nobody's gonna walk in and interrupt you. You've got a cup of tea next to you or a glass of wine or whatever you need, and just nice and relaxed, okay? So to begin the massage, I think it's best to use the left thumb when working on the right side of the pelvic floor, and the right thumb when working on the left side of the pelvic floor, because if you're trying to work on the same side, you just end up in a bit of an uncomfortable wrist position. So it's better to be there and there. Okay, so there's 2 main techniques which I'll show you. They're quite similar but just a little bit different. So the first one, let's say I'm starting with the right hand side. If you've got an episiotomy, it's very, very likely to be in the right hand side. So start with the left thumb. So take the thumb into the vagina. You want to be about a full thumb depth, so all the way in, and then plant the thumb down onto the back wall of the vagina, just right of center. Okay, so your first technique really is just using your pressure there, just right of center on the back wall, and just sinking some pressure in gently, taking the stretch of the tissue in a down and out position towards your foot. So just a few nice deep breaths and just gently sink your thumb into the tissue, holding for maybe 30 to 45 seconds. And then you can lift the thumb off, find a slightly different place to be, again in that just right of center sort of zone. If your vagina is a clock and 12 is your clitoris and 6 is your anus, you're talking at about 5 o'clock. Okay, so about the 5 o'clock position, find another place to just sink your thumb in, sink in the pressure in a nice down and out direction. Okay, and then find another place to be. And then you can swap over, use the other thumb. So this is the right thumb coming into the left. So again, full thumb depth, just left of center, so about the 7 o'clock position, and then just sinking your pressure into that back wall of the vagina tissue. Sink in the stretch in a down and out sort of direction. Okay. So with that sinking, it's not a push, it's not a force, you're not trying to drag the tissue, but equally you are trying to work in on those tightnesses and tensions. So a sinking in is what you want to achieve. You don't just want to be resting on the surface of the tissue, but equally you're not forcing it and pushing it. You're just gently sinking in. Okay. So technique number 2, a little bit different, but same kind of starting position. So again, left thumb coming into the vagina, planting down onto that back wall, just right of centre. And this time take the fingertips and add them onto the perineum. So what you end up with is a kind of pincer grip with a good wodge of the tissue between the finger and thumb. So you've got a wodge about this thick between the thumb, which is on the inside of your body, and the fingers, which are on the outside of the body. You're taking that tissue between the finger and thumb and just working it gently between the finger and thumb. So that can be little squishes, little squeezes. It can be more of a kind of massagey motion, or you can just gently move the whole tissue, just really gently away from you and back towards you. Okay? Similarly on the other side, so that's right thumb into the vagina, planting down onto the back left. Okay? Fingertips onto the outside, onto the perineum, quite near your butt cheek. Okay? And you're taking hold of that tissue. Again, you've got a wodge of tissue between the finger and thumb, and you're just squishing it and working the tissue between the finger and thumb. Okay? Just like this. Okay, so things that you might feel doing that massage, you might feel even a sharpness when you're first starting to work on scars and adhesions, or you might feel like an achiness or a bruising sensation. You might even feel a little bit of something that feels a little bit like pins and needles or Chinese burn. And that's all okay as long as these sensations are mild and as long as these sensations stop once you stop. If you find that you've stopped the massage and you've still got those feelings, then you've worked a little bit too hard. Your pressure has been a little bit too much. So next time, just back off, okay? So doing this kind of work for about 10 minutes most days. You don't need to do it if you've had a busy day or a stressful day or a particularly bad day. You don't need to do it when you're on your period. But essentially, little and often will allow you to work into those tissues and see a good effect. You should not need to use any lube because you want to have a nice grip on the tissue rather than slipping and sliding. If you feel like things are a little bit too dry and uncomfortable without lube, which might be the case if you are menopausal and you've got any vaginal dryness, then do use a little bit of lube, but really just a drop or two, and make sure that you use something natural and organic. So by having a good go at that massage, both sides, most days you should start to see a softening of that scar tissue and so a reduction in its effects upon your pelvic floor, and so you should start to see some symptom improvement. I hope that's been useful. Thanks for listening.